Hello, this is Dr. Feast Price, and I'd like for us to continue our lecture for this week by further discussing family therapy, but exploring developmental and issues related to ethics. As it relates to development, it's important that as you become more astute in learning to become a family therapist, you have to understand development, and not only individual development, but family life development. We also recognize that in order to be an effective therapist, we have to be ethical in our practices and the ways in which we function. And so we'll spend a little bit of time talking about ethics as it relates to family therapy as well. For the first lecture in this week, we discussed that in order to become a family therapist, you must first understand the various developmental and systemic nuances of family life. And the second step is you must possess a knowledge base about the dynamics of individual and family life cycles. And so it's from that vantage point that we will jump into this week's lecture, understanding that the information that is presented here pertains specifically to the individual life cycle of development, as well as the family life cycle of development. There are various individual cycles of development. This one is specific to Erik Erikson, which is widely used and accepted. If you think about individual life development, you can also think about Freud. Freud also had the stages of development. He talked about the Oedipus complex, the Oedipal complex. He had a way of thinking about the individual and the developmental process that the individual matriculates through. For the benefit of what we do as family therapists and the theoretical orientation that is most relevant to what we do, we will pay particular attention to Erik Erikson's cycle of development for the individual. In the first stage of the cycle of development of an individual is trust versus mistrust. And it happens around the age of 1. And that's the relationship that an individual develops with the primary caregiver. And this relationship has to do with the extent to which the needs of the child is being met. So if they're hungry, they're fed. If they need love and warmth and caring, they are receiving these types of interactions from at least their primary caregiver. And research shows that when children are not given the love, protection, support, taking care of their primary needs of not only food, clothing, and shelter, but the social support and protection, then when these characteristics are void, then people are most likely to develop issues of mistrust. And some theorists believe in object relations, and that has to do with the lack of commitment and relationship between the mother and child, or the primary caregiver and the child, that leads to issues of mistrust. And this typically is evident around the first year of age. The second stage of an individual's development has to do with autonomy versus shame and doubt. So when a person receives the social support they need, the social interaction, their primary needs are cared for as it relates to food, clothing, shelter, and social attention and care and love, then they're more likely to move into the second stage in a more positive fashion. And this is where the individual develops the skills of navigating their environment. They have tendencies where they're able to leave their mother, work independently, knowing that when they go back, the mother will be there, or she might take them to a child care facility, but the mother will come back to pick them up, to look after their well-being and attend to their primary care needs. Without this kind of attention, shame and doubt, low self-esteem or low self-efficacy exist. But when these attributes are in place, the individual is more likely to be autonomous in functioning and self-sufficient as well as independent. In stage 3, initiative versus guilt, the individual continue to develop pro-social ways of behaving and interacting with their environment. They're able to navigate their environment comfortably, knowing that their basic needs are addressed and cared for. When their needs are not cared for, issues of guilt exist, and the person might be stymied at this particular stage of development. Also, when you consider just to back up a little bit and say a little bit more about stage 2 autonomy versus shame and doubt, this is also the stage where toileting and potty training begins, and at times you find children that have problems with bedwetting. And so that is one of the ways in which you can determine. So as I was saying, when children experience bedwetting, this is an indication that there is a problem that is occurring in stage 2. And so it might be specific to stage 2, or it could have occurred in stage 1, where issues related to trust wasn't properly developed, where the children didn't develop a sense of trust when caregivers would provide for their basic needs, and as such there are issues related to mistrust that leads to problems with toileting and a child developing a sense of personal independence and control over physical skills. And so as such, in stage 2, children need to develop this sense of personal control over their physical skills, as well as a sense of independence. And success leads to feelings of autonomy and self-efficacy. However, failure may result in feelings of shame and doubt. And as we were saying with regard to initiative versus guilt, this is the time of exploration where the child explores his environment. Children need to begin asserting control and power over their environment. Success in this stage leads to a sense of purpose. Children who try to exert too much power experience disapproval, which might result in a sense of guilt. Along the same lines, you have stage 4 that deals with industry versus inferiority. And this is about the time when children are in school, so they're going to school for the first time, they're meeting their peers. And so children need to cope with new social and academic demands. There is the belief that success leads to a sense of competence, while failure results in feelings of inferiority. And so just to reemphasize, failure at either of these stages can manifest itself later on and lead to problems within the family, as well as problems for the individual as they navigate the environment around them. The next stage of development is identity versus inferiority. And as it relates to, and I think we talked about identity versus inferiority. It's actually industry versus inferiority. We move to stage 5, which is identity versus role confusion. It occurs during adolescence, which is between the ages of 12 and 18. This is the time where social relationships are developed. And so teens need to develop a sense of self and personal identity. Success leads to an ability to stay true to themselves, while failure may lead to roles of confusion and a weak sense of self. So they're more likely to become leaders, followers rather than leaders, should they fail to develop a sense of identity. Role confusion is more likely to occur. The next stage, or stage 6, is intimacy versus isolation. It also has to do with relationship development. And so this is during the time of 18 to 35, where young adults need to form intimate, loving relationships with other people. Success leads to strong relationships, while failure may result in loneliness and isolation. And so when people experience problems with intimacy and isolation oftentimes is the end result. So you know that if a person is coming in for treatment at stage 6 and they are within a particular age range, intimacy is a primary issue that one would have to consider. And without working through appropriately issues related to intimacy, it can lead to a person feeling isolated, whereby they have problems forming meaningful adult relationships. The next phase is stage 7, which is generativity versus stagnation, and it also occurs between the ages of 40 and 65. This is during the time when persons are working and parenthood is of paramount importance. So individuals need to create or nurture things that will outlast them. And oftentimes that includes having children or creating a positive change that benefits other people. So success in this particular stage can lead to feelings of usefulness and accomplishment. However, when there are problems that exist within this particular stage, you are most likely to see failure, which might result in shallow involvement in the world. So stagnation and just minimal involvement in their day-to-day activities and living life in a more stagnant and superficial way. Maturity occurs at the 8th stage, and it's between the ages of 65 and older, so whatever the older is, it's really from 65 years old to death. And so it involves ego integrity, or integrity versus despair. And this is a time when individuals reflect on their life, and older adults need to look back on life and feel a sense of fulfillment. Success at this stage leads to feelings of wisdom, while failure results in regret, bitterness, and despair. So it's important that as a clinician who is involved in family therapy, you want to pay particular attention to the stages of development that the individuals that you're working with are in. So you might have a husband that is in a particular stage of development. He might be feeling in stage 6 where he's been successful with intimacy. However, he may have a partner who, in terms of their individual development, they might be having issues with isolation. So you always want to look at the individuals separately to try and understand where they are in their individual cycle of development and determine what might be some of the issues that are limiting their ability to move from a place of being less functioning to higher functioning. Along the same lines with understanding individual development, you also must understand the family life development. So we know that the family life cycle describes the developmental trends that exist within the family over time. And there are 6 stages that are specific to the family life cycle. So the first stage of the family life cycle has to do with single young adults. It often occurs when the individual leaves home and begins their life as a single young adult. For some individuals, it might mean leaving and going off to college. For others, it might mean going off to the military, and others, it just might mean moving out of their family's home and getting their own apartment. But the first stage involves the single young adult and leaving the nest. The second stage involves the new couple or the joining of families through marriage and commitments. So that's when individuals, after leaving home, they meet people, they date, they fall in love, they get married, and as a result of getting married, there's the joining of families through marriage and the commitments that go along with it. The third stage of the family life development deals with families with young children, and I've stated previously that when families have children with special needs, along with those stressors of having the special needs child, it also impacts the children, it impacts the couple. And so research shows that couples with children with disabilities oftentimes end in divorce because of some of the stressors that are placed on the family. So you also want to recognize that depending on where the couple is, in terms of whether they're in stages 1 through 6, will also determine the kinds of stressors that exist within the family. So if there are young children within the family, along with having young children are certain stressors that go along with parenting and having a family. A lot of the attention is focused on the children, less attention is focused on the husband, the wife, the partners in the family, and sometimes the family can there is disequilibrium within the family if too much attention is placed upon the children and less attention is among the adults are placed on each other. Along the same lines, we know that when families have children with adolescents, that brings on other kinds of nuances within the family. Some people say that when children become adolescents, there's something called adolescent psychosis where the prefrontal cortex is not fully developed. So adolescents struggle with making sound decisions, and as such, parents are stressed with some of the issues associated with adolescence, which can also impact the family in a negative way. It might mean that the husband and wife within the family is giving less time to each other. More time is devoted to the children, or some of the imbalances that might exist with the children can negatively impact the husband-wife relationship and the overall family structure. Stage 5 of the family life development discusses launching children and moving on. And so this is where there's the empty nest syndrome, where children matriculate through school, graduate, and go off to college, leave the home, and become self-sufficient, independent. And so these are the empty nesters. Again, families that are all-consuming with children, and when the children move away, sometimes the family can disintegrate because the children have created this void that the parents do not know how to fill. So depending upon what the issues are and where they are with the children, you have to be mindful that the problems with the children can impact the marriage and thus the entire family. And then you have families later in life, you have the caregiver kinds of issues where parents, they have what's now called the sandwich generation, where the husbands and wives are not only taking care of their children, but also their elderly parents. And so these are times when you have multiple generations that are within the home, or multiple responsibilities as it relates to caring for not only the children, but for the families. Or there's also the families that are later in life. You have people that have retired from work, they're becoming senior citizens. And so there are various stages, various attributes or characteristics that exist within the family once they reach stage 6. Sometimes it's grandchildren, sometimes it's families that are elderly with elderly parents that are then required to be the caretakers of the grandchildren. It also might mean families that have their adult children and grandchildren moving back into the home because of the economy, which is a lot of what we're seeing currently in the family structure. But all of these stages can bring about certain kinds of problems or impact the equilibrium of the family. So as you function as the family therapist, it's important to understand where within the family life cycle the problems are occurring and try and right the problems that exist to bring about more healthy functioning within the family. So why include the family in the rehabilitation process? You know, oftentimes when we think of family therapy, we think of family therapy apart from what we do as rehabilitation counselors. So we recognize that as persons with a degree in rehabilitation counseling, you can become a licensed clinician, you can become a licensed professional clinical counselor, and with that credential allows you to work in a mental health treatment facility or even open up your own private practice where you work with individuals or children or adolescents or families. And so in those instances, you want to make sure you have the appropriate clinical skills to work as particularly a family therapist. But we know that as rehabilitation counselors, we might work in the Office of Vocational Rehabilitation or the VA, and in those instances, we must also have requisite skills and knowledge to positively impact the individuals with whom we serve. And so we must understand families and how to positively impact families. So as such, an individual, we have to recognize that all individuals are a part of and significantly influenced by a larger family and social system. And sometimes these social systems can impact on one's ability to become more self-actualized. We also know that research shows that a family may influence an individual's feelings of independence and competence, changing their self-defeating beliefs, improving adjustments to work, complying with medical rehab programs, as well as facilitating adjustment processes. So we know that when the family is involved in the process, as a rehabilitation counselor, the extent to which you involve the family in the process, individuals feel a greater sense of independence and competence. It allows them to change self-defeating beliefs, improve self-adjustment, or improving adjustment to work, and complying with medical rehab programs, facilitating adjustment processes. I have seen personally that when family members are not involved, particularly when persons come from a sense of community that helps to impact their decision making, if you fail to include the family, there are other problems that can occur later on because the family is excluded from the process. So we recognize that it is important, irrespective of the path that you choose as a rehabilitation counselor, it's important to understand families and how to integrate families or families' input or involvement in the rehabilitation process. We recognize that families can negatively influence the process, the rehabilitation process. So there are negative influences of the family. I have seen instances where when families are not involved or vested in what the individual is attempting to accomplish, the client or customer or consumer may resist the rehabilitation efforts. Also, family members, some people come from collective cultures. When you look at Latinos, Latinas, African Americans, Native Americans, Asians, Pacific Islanders, these individuals come more from a collective family where they give input and help to influence the process. As such, it's important that they have some involvement, because otherwise they can undermine the independence or self-sufficiency of the individual. Family members can also minimize the process by encouraging helplessness for the individual, and they can hinder the positive changes that you're trying to accomplish in the rehabilitation process. And they can, and this can totally negate the positive aspects of work that you're trying to accomplish. So if family is not a source of support, additional resources must be identified and made available to best assist the individual that seeks to become more self-sufficient and independent. In this part of our lecture, we'd like to move into ethics, and recognizing that ethics is at the genesis of what we do as clinicians. And if we are not cognizant of ethics and the proper use of ethical behavior and ethical decision making, it could wash out all the hard work that is going into becoming a rehabilitation counselor, the master's degree, and becoming a CRC, and also becoming certified as a licensed clinical counselor is a wash if you're not appropriately functioning from an ethical standpoint. And so it's from that context that I'd like for us to talk about the Rehabilitation Counseling Code of Ethics, and understand what it says about ethics and ethical decision making with meeting the needs of clients. And as it relates to the CRC, so under Section A, the counseling relationship, it speaks to client rights. And under Section A.3 and F speaks to the involvement of significant others. And as it relates to the CRC, it says that the rehabilitation counselor will attempt to enlist family understanding and involvement of family and or significant others as a positive resource if or when appropriate. The client or legal guardian's permission will be secured prior to any involvement of family or significant others. So yes, you want the family members involved. However, you want to make sure that you have the client's permission before involving family members. If the client doesn't give permission to have the involvement of others, then you do not want to include them in the process. So first and foremost, the client or the customer has to give permission before any family members can be involved in the process, the counseling process. But it also states very clearly that the rehabilitation counselor will attempt to enlist family understanding and involvement of family and or significant others as a positive resource if or when it is appropriate. As it relates to confidentiality and groups and families, but specifically family counseling, the Code of Ethics B.2.B states, in family counseling, unless otherwise directed by law, information about one family member will not be disclosed to another member without permission. Rehabilitation counselors will protect the privacy of each family member. So it's important to remember that there are times when you're working with the family as a whole, or you might work with one particular member at a time, but when that occurs, you must be mindful to maintain confidentiality, maintain in confidence any information that has been communicated by the client or the family member in that therapeutic context, and only share or divulge that information with the client's permission. So why is the family sometimes left out of the rehabilitation counseling process? Because we know that families are important, but we also recognize that sometimes family members are left out of the rehabilitation process. And this happens when there is a failure of the client to see rehabilitation problems in a family systems framework. So sometimes it might be the values of the counselor where they are strictly focused on the client or the individual. They don't have any respect for the collective nature of other families or the culture from which some clients come. And so when there is a failure for counselors to see the rehabilitation problem from a family systems framework, they're much more likely to focus on the individual rather than recognizing the benefit of having the family's involvement. Sometimes there's also the feeling that contacting the family or involving the family requires special training. So there's a lack of self-efficacy in working with family members. So because of the lack of self-efficacy, it's more likely that the family will not be included. Also, we recognize that there may be little time or interest on the counselor's part to have the family involved, because with working with families, it's more time consuming. You have more schedules to take into consideration, more points of view to weigh into the decision-making process. So there are times that these are some of the factors that impede the extent to which the rehabilitation counselor is willing to involve family members in the counseling process. We recognize also that research helps to inform the importance of involving family in the rehabilitation process. And the research says that there are far better rehabilitation outcomes in clients who have positive family support and involvement. So if you know that family is important to the client, if you know that the family can impede or enhance the success of the client, you want to involve the family in the process. If the family is not an active part of the client's life, you don't want to involve family members where family members are not currently involved in the life and daily well-being of the client. But to the extent that family members are involved, you definitely want to involve them in the counseling process. However, you can only do so with the permission of the client. So this concludes our discussion for this particular week. I hope you have found the information helpful to you as you further explore family therapy and the opportunity to positively impact the lives not only of individuals but from a family systems perspective. Thank you for your attention.